and welcome back to The Naked Truth, Access to Safe Abortion as a Human Right and Saving Lives Matters series, brought to you under the SAfAIDS flagship My Choice, Our Choice campaign, which is generously supported by Sweden under the regional Transforming Lives program. The campaign seeks to contribute to a SADC region where adolescent girls and young women can access free from judgment, legal and safe abortion services, supported by men and boys, community leaders, as well as policymakers as a strategy for addressing maternal mortality and morbidity. The SADC region continues to record a high incidence of maternal mortality and morbidity due to a number of health development factors, including consequences of unsafe abortion, with unsafe abortion being cited as the fourth leading cause of maternal mortality and morbidity. To help us understand how we can address unsafe abortion as a strategy to also address maternal mortality and morbidity is Ms. Tendaishe Changamire, the Advocacy Adviser from Population Services Zimbabwe. Tendaishe, welcome to The Naked Truth.
Thank you, Shamai.
Okay. According to regional and global reports, consequences of unsafe abortion are cited as the fourth leading cause of maternal mortality and morbidity. Is this the same case for Zimbabwe?
Yes, definitely. So our colleagues at the Ministry of Health can actually attest that unsafe abortions are in the top 4 causes of maternal mortality in Zimbabwe. And this is, together with hypertension, hemorrhage, and sepsis that contributes to the high maternal mortality rates in Zimbabwe. Currently, according to the Zimbabwe multi-cluster survey, we are at 462 deaths per 100,000 births. And this is still high in comparative to the other countries in the region. And just looking at the accepted maternal mortality, if there is an accepted, but to just compare in the region, we have a high maternal mortality rate. And unsafe abortions, the complications that come with them are contributing a huge number of this rate.
So just going back to some of the statistics that you're raising, when you really break it down, you realize that a high incident is recorded amongst adolescent girls and young women. Do they have an understanding and appreciation of the consequences of unsafe abortion?
Well, yes and no, because we do have a Termination of Pregnancy Act in Zimbabwe, which means that we actually have a policy that governs the circumstances to which a woman can terminate a pregnancy. But we find that most service providers, most women, most adolescent girls, and the community in general are not aware of this law. So there is a huge misconception that, abortion is a crime in Zimbabwe, or abortion is totally illegal, and people don't understand or at least appreciate that there are circumstances that are allowed under the law to terminate a pregnancy. So you see that the criminalization aspect or the criminal sanction within this law then makes young women and adolescents afraid to even talk about and address the subject, and they resort to unsafe abortions. And so because most people know people in the community who are administering these unsafe abortions, or that they know someone who's accessed the services, they are not really aware of the complications of this practice. And most are not even aware that the complications can be as serious as death.
So when you started earlier, you spoke about the Ministry of Health, for example, having statistics, right? And also just the different subgroups, whether it's service providers or adolescent girls and young women themselves, having some sort of understanding of the threat of unsafe abortion. But is the current policy environment, which is restrictive, not only in Zimbabwe, but across the SADC region, is the current policy environment then hampering some of the efforts that have been put in place to address maternal mortality?
Yes, definitely. And I think I want to talk about, post-abortion care in direct response to that question. So, like I said in the beginning, termination of pregnancy has this criminal sanction for anyone who terminates a pregnancy outside the circumstances of the law, or any service provider who provides the service outside the circumstance of the law. So because of this, people think that they can't even access post-abortion care. So in Zimbabwe, we do have guidelines that say that if a woman, presents complications from an unsafe abortion, they can walk into a health institution and they can be treated from these complications. But because there's that criminal sanction that is in the current Termination of Pregnancy Act, a woman might actually fear going to a health institution with their unsafe abortion complications because they're afraid of being asked the question of, why did you terminate a pregnancy? Therefore, you can be presented to the police. I mean, it was a practice that used to happen a long time ago, but it's no longer happening because of the strategies and the guidelines that have been provided by the Ministry of Health. So as long as we have restrictive law, we know that the restrictions in law will not only hinder abortions within the circumstance, but they also hinder women actually seeking treatment when they are supposed to.
But is this information then readily available? Since it's a strategy. If we were able to prevent unsafe abortion, it's a ripple effect. We also prevent or reduce the incident of maternal mortality and morbidity. Is the information readily available to adolescent girls and young women?
So not really. I think the information is not readily available. We do have a lot of work to do as CSOs, but also as, together with the government in terms of disseminating this information. One of the reasons that make this information not available is that termination of pregnancy as a subject is taboo in our society. So I think the questions we often ask ourselves is, how do we go with this topic? Which entry points do we use to bringing up this topic? And I know that if we were even in this program talking about it, we will have a lot of people, either shying away from listening to the conversation or even just shying away from participating in it if we wanted to then further engage the community. So I think that, the fact that there's still a lot of stigma and discrimination that is associated with the subject, it means that even the information dissemination takes a bit, longer, has to become a bit more strategic, so that everybody really gets the information.
Okay. And how will the reform of restrictive laws, for example, contribute, or how significantly would it contribute to the reduction of the incident of maternal mortality?
So I think one of the things that we really have to accept when it comes to reforming the law is that it doesn't always translate to attitude change. So yes, the reform of a law would break the silence on the topic. The reform of a law will, build the political will to build the infrastructure, to resource access to these services. But whilst we're talking about reform of law, we also need to talk about a lot of work that we need to do around attitude and value transformation. So when we reform the law, we'd have to take it into communities, would have to take it to the service providers so that there is that huge acceptance of what termination of pregnancy is, why it should be allowed in which circumstances under law, but at the same time, why it is necessary in terms of addressing the maternal mortality rate as a public health issue.
And how easy is that conversation?
Not very easy. Like I said, there are, there's a lot of stigma around it. I mean, let's just talk about that Zimbabwe is over 80% Christians. And Christians, strongly believe that abortion is murder. So how do you start those conversations is what we now need to be looking at. But we also need to look at our culture as well, because we've gone in communities with this subject, and at the first instance, people are like, no, we don't want to talk about abortion. And then we talk about the circumstance of abortion under rape. And then people start accepting and say, you know what, that could be discussed, because how can we have, a child, how can we bring up a child without a totem, right? Because they are starting to accept that there are circumstances where a woman will find herself actually thinking about and seeking a termination of pregnancy. So the conversations are not easy, but I'd like to say that, compared to maybe 10 years ago, people are starting to understand this. People are starting to understand the complications of abortion on women's life, but also the implications they have, the complications have on our public health systems. It's more expensive, for example, to provide a post-abortion care than it is to provide a safe abortion. So that sort of understanding, when we bring it to the community, when we have people understand what our maternal mortality rate is like and what the contribution of unsafe abortion is to this maternal mortality rate, then there is that slow acceptance of doing what's right, doing what's necessary, even when we all don't agree on the principle of it.
Thank you very much, Tishe. Having restrictive policies does not necessarily deter women and girls from accessing abortion. So even in circumstances where there are restrictions, the alternative usually is unsafe means. Join us after the break as we continue with this conversation. Welcome back to the second segment. Today we have Tendaishe Changamire from Population Services Zimbabwe discussing how we can reduce the incidence of unsafe abortion as a strategy to address maternal mortality and morbidity. Tendaishe, welcome back.
Thank you, Shamila.
So what measures can we put in place, to ensure that public health systems and communities at large are ready to support, a conducive policy environment that supports access to safe abortion for adolescent girls and young women?
So the first, I think I've got three things that come to my mind instantly. The first thing is building the knowledge and political will of our policymakers. I mean, when we talk about policy reform, there is no way we can discuss this without policymakers having the political will to even move policy in Parliament or even implement policy that's passed by Parliament. So we still need to do, continue our work in ensuring that our policymakers are actually aware of the statistics that we're talking about on maternal mortality, but also building this mostly as a case of public health, and that would inherently affect the development of this country. The second thing I could talk about is now moving to the policy reform. So when our policymakers have the political will and they push policies, we need to start talking about what kind of policies we want to look at. So currently in Zimbabwe, we do have legislation that supports reproductive health, like our constitution in section 76 and section 52. We also have, a lot of other strategies that are within the Ministry of Health that deal with maternal health, that deal with adolescent reproductive health, that deal with family planning and all those issues. But when we now move to the key acts, like the Public Health Act and the Termination of Pregnancy Act, we see that these are failing a little bit in terms of being sufficient to address the issues that we have. So we now need to start looking at those policies really seriously. We ask our policymakers to really push them in the House and review them so that they support maternal health for women, they support reproductive health in terms of breaking down what it means, and also support access by adolescents and young people. And I think the last question you asked is the one that really interests me the most, because this is now having the community, garnering the support of the community towards supporting these laws and implementation. We need to get out there and disseminate the information. We need to talk about the current act. A lot of people, like I alluded to in the beginning, are not even aware that we do have a Termination of Pregnancy Act. They are not aware that even our Constitution allows an Act of Parliament to determine when a pregnancy can be terminated. So we need to take these laws into the community. We need everyone to understand the implications that these are having, because in most cases you might know a next door neighbor who's had an unsafe abortion and maybe had complications out of it, but the bigger picture is the one that people are not aware of. Do they know what it means as a bigger picture for our country? So I think those three things are things that are measures that we could take instantly, to address our maternal mortality rate, specifically the contribution of unsafe abortion to this rate.
So as we strive to address challenges associated with consequences of unsafe abortion in Zimbabwe, what lessons can we draw from other countries within the SADC region or even the African continent as a whole?
Yeah. So the biggest lesson is that this has to be done. We look at countries like Rwanda and Zambia, who are over 90% Christian. 90% of their population is Christian. But they've got these laws in place that facilitate that women access safe abortion. So Rwanda, for example, took a huge stand a few years ago to just make sure that the access is available. And what's interesting about Rwanda, like I said, is when you look at it, vis-a-vis our country, in terms of our beliefs, our values, we're not different. So I think those are the lessons that we can draw. We can draw that it is necessary to do. And like I said in the beginning, it's doing what's right. It is doing what's necessary in terms of public health. Even when we all don't agree, we don't have to agree, but we all have to say that no woman should lose a life, at least to an unsafe abortion, and we can stand and address that despite our differences.
Thank you very much, Tendaishe. No life should be needlessly lost. Almost all cases of unsafe abortion can be prevented, and the lives that are lost can be saved. Join us in our third segment.
At 16, Alice was not ready to have sex with her boyfriend, but because she wanted to stay together, she found it hard to say no when he pressured her. She asked her healthcare provider for contraceptives, as the law allows, but was shamed for having sex and was turned away. Later that year, Alice became pregnant. Alice was not ready to be a mother, and because she was afraid of being judged and turned away again, she sought the help of a stranger who said he could help. Alice had an unsafe abortion and became very sick afterward. The doctors later told her she almost lost her life. Alice isn't alone. Thousands of adolescent girls and young women like her may find themselves seeking unsafe abortions, accounting for over 10% of maternal deaths. Why? Some, like Alice, face stigma and judgment from healthcare providers, family, or friends. Many don't have access to sexual and reproductive health services, including contraception. Some are survivors of sexual assault or have abusive partners. Some never received comprehensive sexuality education, and when reproductive health care, including safe abortion services, are difficult to access, it puts their lives in danger. Alice's story shows how unsafe abortions are dangerous and can be deadly. Her story didn't end in tragedy, but many others do. Providing access to safe abortions is how we as a community put the lives and well-being of our sisters, mothers, and daughters first. Policymakers must be proactive and change restrictive abortion laws to save lives. To learn more, visit SAfAIDS.net. My choice, our choice.
Thank you and welcome back to the third segment. We're still discussing how we can address unsafe abortion as a strategy to address and prevent incident of maternal mortality and morbidity. Tendaishe, welcome back to our last segment.
Thank you, Charmaine.
So you've raised the statistic. We've spoken about the lessons that are available, from other countries. So what is your call to action, for our leaders in Zimbabwe and across the SADC region?
Yeah. So let me just reiterate on the statistics, because that's how I can strengthen my call for action. Charmaine, almost 67,000 women go through induced abortions annually in Zimbabwe, and this is according to the Guttmacher Institute. And we're talking about women unintended pregnancy here, which are 40% of pregnancies in Zimbabwe are unintended. 1 in 4 of those unintended pregnancies end in unsafe abortion. And about 40% of this end in complications, and only half get treated. 1 in 5 women then lose their lives to an unsafe abortion. And if that doesn't move, our policymakers, I don't know what will. Our call to action is that we save lives. This is a matter of lives. This is a public health issue when you think about it, even when you just look at the numbers I've presented. So our call to action is that we save lives above all. And we recommend that one of the ways we can do this is look at our Termination of Pregnancy Act. In our Termination of Pregnancy Act, we're criminalizing women who decide or who choose to access an abortion. But our current Termination of Pregnancy Act, as it is not sufficient for even women under the circumstances that it allows. It's not sufficient for women to access that service. We look at the Mildred Mapingura case, where Mildred was raped and therefore was eligible under law to access the termination, but did not, because there are a lot of barriers. We look at the issue around health circumstances, where it requires 2 doctors. What happens to the girl in the rural areas? They will seek an unsafe abortion. So let's just save lives. Let's address the Termination of Pregnancy Act. Let's look at the administrative barriers in it. Let the Ministry of Health come up with regulations. The law is a 1977 Act, and since 1977, the Ministry of Health has never passed any regulations to it. But it's such a vague law. It has things that are not clear in it. It only allows public health institutions to provide the service when it's allowed. So let's look at that. So I think I would call the policymaker to really think about all these things, to really think about all these barriers, but to also uphold the commitments that we've made on international and regional frameworks, CEDAW, Maputo Protocol. Let's just uphold those commitments and ensure that no woman loses a life.
Just speaking to what you've just raised on the different protocols that exist and the documents that we committed to, how do we ensure that we translate not only those documents, but the statistics as well, translated so that the adolescent girl and the young women in the community can understand, the plight of their peers, as well as the commitments that have been made by our leaders to ensure that their health and their well-being is guaranteed? How do we translate that so that we rally the community of adolescent girls and young women and other populations within the community to also, demand for our policymakers to be accountable?
Yeah, that's true. So we just need to start the conversation. We need to open up the conversation. I think one of the things that we all accept and understand is that whilst there are circumstances that are legal to terminate a pregnancy in Zimbabwe, talking about it is not legal. Because those are real issues. Sorry, talking about it is not illegal. Because these are issues that young women and adolescents are actually going through. So we need to now create a society that is open to listen and that is open to talking about it. So the adolescents and the young women might not be aware of the laws or the strategic frameworks or the regional and international frameworks I've talked about. But if you go and have a conversation with them, they are aware that their peers are seeking unsafe abortions. And if you talk to them, you will know why and you will know where. We just need to open up that conversation so that we gather as much evidence as possible that will then empower us to make informed decisions when it comes to reviewing our policies and our laws.
Thank you very much, Tendaishe. This has been a very interesting conversation, and thank you for raising the very important points and important facts, that no life should needlessly be lost.
Yes, thank you so much, Charmaine.
Okay, thank you. Thank you very much to Tendaishe for joining us today and calling for our leaders to take action and safeguard the health and the well-being of adolescent girls and women. Unsafe abortion-related illness, injury, disability, or mental health challenges can easily be prevented. This has been the Naked Truth Show. Access to safe abortion is a human right, and Saving Lives Matters series, brought to you by SAfAIDS in collaboration with Biotech Development Institute as part of the flagship My Choice, Our Choice campaign, generously supported by Sweden under the Regional Transforming Lives program. Join us for the next episode. But remember, changing laws saves lives. My choice, our choice. Goodbye.